Before any medications can be prescribed for a patient on medical wards and ED, a VTE risk assessment needs to be completed in ePMA. On medical wards and ED, only emergency stat medications can be prescribed before a VTE risk assessment is completed. For patients on surgical wards, VTE risk assessments are currently completed on a separate paper form rather than in ePMA. To complete a VTE risk assessment, we prescribe it as if it were a drug. Let's select the quick list. Then click on the VTE thromboprophylaxis and form. Select the risk assessment for venous thromboembolism, VTE. With the assessment selected, click Continue. In the Schedule and Details screen, click Continue. In the Chart Update screen, click Update. You are now presented with a Medications Warning screen, with details about VTE form completion. Select the VTE Risk Assessment button. There are 4 sections to complete in the form, the first of which is Patient Mobility. Select which of the 3 options is applicable. In this example, we are working with a medical patient who is expected to have reduced mobility relative to their normal state. The second section is Thrombosis Risk. If the patient was surgical or medical with reduced mobility, tick any relevant boxes in the Thrombosis Risk section. If none apply, select the tick box next to "If nothing selected for thrombosis risk, confirm by ticking here." In this example, we'll record that the patient has the following thrombosis risk factors: age is greater than 60 and dehydration. To see the rest of the form, we'll need to scroll down. The next section is Bleeding Risk. If one or more thrombosis risk factors have been selected, you are required to review the bleeding risk factors and select any that apply. If none apply, select the tick box next to "If nothing selected for bleeding risk, confirm by ticking here." And the final section is Action to be taken based on risk assessment. In this section, select which of the 4 actions you are going to take based on the outcomes of the VTE risk assessment. Please note, the form is for information input only. There is no decision support to guide you based on the risk factors and bleeding risk as to appropriate treatment. This is a clinical decision that needs to be made by you as the prescriber. This box will also not complete the action for you, and it's important, if thromboprophylaxis is indicated, that the next step after adding the VTE assessment is to prescribe any appropriate treatment. If the patient information has been given, select this tick box. With the form completed, you can then select Save. You are returned to the Medication Warning screen. You can now select Override, and then click Continue. The VTE risk assessment is now recorded against the PRN tab of the medication chart. It sits there for the remainder of the admission, as a reminder that the assessment has been completed on the date prescribed. Click the PRN tab. To take a look back at what was recorded on the form, you could click the Clinical Decision Support Warnings icon.